Hello, everyone. Welcome to Health Professional Radio. I'm your host for today, Tabitha Moretto. Our guest today is Dr. Hendra Gunawusi-Woyo, Senior Lecturer at the Australian Research Council. He's also an Early Career Research Fellow within the School of Pharmacy and Biomedical Sciences at Curtin University. In the lead up to World Tuberculosis Day, we're going to talk about new treatments for tuberculosis as part of an ARC-funded research project. Without further ado, welcome to the show, Hendra. It's so nice to have you here.
Thank you, Tabitha, for having me. Glad to be here.
Yes, my pleasure. So, Hendra, please tell the audience more about yourself and the nature of your work.
Thanks, Tabitha. So, as you alluded before, I'm a senior lecturer in the School of Pharmacy and Biomedical Sciences at Curtin University, that's in Perth. At the moment, I'm also holding a early career research fellow position with the Australian Research Council. Born in Indonesia, I moved to Sydney in about 2000 to pursue my undergraduate and postgraduate degree. I have a PhD in the area of medicinal chemistry from the University of Sydney, and I then pursue my postdoctoral experience in Chicago, USA, before joining Curtin in 2014. Being an academic at the moment, I'm both doing teaching and research at the same time. So what I'm teaching to our undergraduate and postgraduate students at Curtin are the chemistry-based units at all levels, and at the same time, I also do basic research in the field of the tuberculosis. So a bit more detail on the research side, I guess. Our team is quite multinational, and it comprises of us, the chemists, so those who actually make compounds in the laboratory, and our biologist team in the USA, who then do the range of biological assays for the project.
That sounds very fascinating. As we know, tuberculosis is something that's considered a treatable disease, but why is it considered to be one of the world's leading causes of death?
That is one question. So firstly, Tabitha, let's go through what do we know about the disease itself, tuberculosis. In about 1800, Robert Koch actually discovered that tuberculosis is caused by an organism called Mycobacterium tuberculosis. And we do know at this stage that there are active versions of tuberculosis, and that's where the patients actually show the actual symptoms, coughing, the sputum in the lungs, chronic coughing, as well as the latent version of the tuberculosis, which means it just stays dormant within your system, so the bacteria doesn't really grow, and the symptoms doesn't really manifest itself. But three main things, Tabitha, that really sort of confounds our global control of tuberculosis are, firstly, the global issues of the emergence of the multi-drug as well as extensively drug-resistant form of tuberculosis. And this, in part, actually came from the lack of patient compliance, which obviously leads to failure in the treatments, and that leads to an increased mutation rate for the bacteria itself. And bear in mind, this is a very ancient bacteria that has been in close contact with humans for a very long time. And lastly, in some endemic areas, such as South Africa and India, TB actually coexists with HIV, and so that actually brings about some degree of difficulty in really controlling these two diseases happening at the same time. But really, to answer your question, how does curable disease continue to be the number one killer? Really, the big problem is the resistance of this very bacteria itself.
I see. So can you tell us about your research regarding new treatments for tuberculosis?
Absolutely. As I alluded before, so MTB, or Mycobacterium tuberculosis, it is highly unique bacteria. So we do know that from the structures of the bacteria, it has a very special kind of cell wall. And we do know that the cell wall of the Mycobacterium tuberculosis is quite unique And while we do actually know some parts about the enzymatic pathways that control the biosynthesis of the cell wall components, there is still a lot of components that we're not sure as well. So what our research is actually trying to achieve is we're going to do basic chemistry and biological sciences in order to actually better understand how the cell walls of these mycobacteria are actually synthesized. So as I alluded before, so with the basic sciences, so from the basic chemistry, what we do is we synthesize a molecular probe that we can then use to actually investigate some mechanisms of, for example, essential components that are important for the cell wall integrity. By doing that, we're ensuring that we could find or we could better understand the mechanism of the biosynthesis, and thus we could design in the future treatments that could be possible, new treatments for this disease.
That's good to hear. Hopefully in the future there'll be a new treatment for this disease.
Absolutely, yes.
So Hendra, if you don't mind, can I ask you a personal question?
Absolutely, go ahead.
Why are you so passionate about tuberculosis research?
It's, as I alluded before, Tabitha, so I was born in Indonesia, and in Papua New Guinea especially, there is actually quite a high concentration of the tuberculosis itself. In emerging countries like Brazil, some parts of Russia, India, China, and South Africa, these are really, really serious issues. And so I guess coming from that, when I grew up, we did hear about the issue of the tuberculosis. And I guess that sort of gives me a personal drive to actually keep moving forward, trying to contribute to the research within this area. And in that regard, I'm very fortunate to have a fellowship coming from generously from the Australian Research Council, as well as the great collaborators that we have in the US, in China, in South Africa, to actually pursue this project.
That's wonderful to know that someone like you has a great desire in order to contribute to the fight against tuberculosis.
Thanks.
Doctor, I would love to talk to you more, but we're running out of time. But before we go, what is your main takeaway message to all of our listeners out there? What would you like to tell them?
I'd really like to say that tuberculosis, it is a curable disease, but it has been haunting us for a long time. And in the wake of this World Tuberculosis Day 2018 that just happened last Saturday, it is actually encouraging to see the United Nations incentive to actually stop TB or end TB by 2030. And even from the India government, we actually saw they're very ambitious in saying that try to beat that deadline by 5 years. It is just amazing to see this sort of passion being put into this fighting this disease. And really, it is not one solution fits all, but we're hoping, at least from our side as a basic scientist, we're hoping that our contribution from the research side can actually be helpful, not only for the treatment of tuberculosis, but also we have to be aware that other mycobacteria are also implicated in other lung diseases, such as COPD, chronic obstructive pulmonary disease, as well as cystic fibrosis. So the knowledge that we actually gain from our research could potentially be brought forward to other kind of mycobacteria-related diseases.
That was a fantastic message. And for those who want to get in touch with you, how can they do that?
I am based at the Curtin University in the School of Pharmacy and Biomedical Sciences. Those of you who are in local, we're in Building 306. But otherwise, I can be reached via email or by phone as well.
That's wonderful. Thank you so much, Hendra, for coming on the show. It was fantastic.
Thanks, Tabitha, for having me.
And that was Dr. Hendra Gunawusi. We've just been talking about tuberculosis and new treatments for this condition. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. Show us some love by subscribing to our HPR YouTube channel. We're also available for download on SoundCloud and iTunes. I'm Tabitha Moretto, and you're listening to Health Professional Radio.